And today we have with us Dr. Prokopios Magiatis, is an associate professor of pharmacognosy and national products chemistry at the Department of Pharmacy of the Kapodistrian University in Athens. I met Dr. Prokopios Magiatis back in 2012, and so nice to see you again, Mr. Magiatis. It's been a while since we made a video like that.
Yeah, nice to see you too.
And I was remembering back in 2012 when we first met, which was when you first announced the development of the NMR method, the nuclear magnetic resonance, to measure the polyphenols in olive oil phenol compounds in very quickly in one pass without using reagents. And that prompted me to come to Greece actually and hear you announce it in a village up north, which was where some of my family is from, an aunt of mine. So I came over there to hear you speak. And then I interviewed you for the first time. And but a lot has happened since then, because I was thinking just the other day that there's the most amazing thing and the most positive aspect, because there's been a lot of negative things, but the most positive aspect is that I see that there's been all this research and clinical trials that have been done, and they've been funded from the olive growers themselves. There hasn't been any government funding or research grants and so forth, except for the one program we did with the EU. But as far as the clinical studies, to see the effect on the human disease or to alleviate symptoms and so forth. So all these clinical trials were funded by the olive growers themselves. Either directly, they gave olive oil and also money, or by having their olive oil tested at the World Olive Center that you have created along with Dr. Eleni Meliou and some other internationally well-known research scientists. Then that money went to do this research. That is a phenomenon, I believe, in the world. It's and I wanted to talk about that and list all the research that you've done in this very unique way.
Yes, it is true. And indeed is something that is not commonly done in the scientific community, because in most places in the world, scientific research is funded by governmental funds. But in our case, most of the clinical studies or the studies in animal models have been funded by the olive growers by themselves, or through the non-profit organization, the World Olive Center for Health. Indeed, this is something which is very different from the common practice, but we are very happy because through this mechanism of funding of research during the last 8 years, we have performed 9 very important studies. And most of them are in humans, almost all of them are in humans. And we have offered significant knowledge about the health protecting properties of high phenolic olive oil. And we are very proud about this, and we're very happy that we managed to motivate hundreds of olive oil producers around the world, and especially from Greece, to support this type of research.
It's not at the best of times. I mean, Greece is still in crisis since 2012, an economic crisis, and they're willing to give what little they have and sacrifice their olive oil because, let's face it, it is expensive. They sell it at a very high price, and it costs a lot to produce. So they're giving something that is very valuable to them for this research.
Yeah, but this is the proof about the value of the research, because everybody understands that if we have solid data about the usefulness of high phenolic olive oil on the health protection, then it's really worthy to give money towards this direction. I think that everybody can understand this. And I will have all to explain that in most cases, the support was very small amounts of money, but from many people.
Mm-hmm.
It's something like crowdfunding.
Right.
But of course, besides this, we had producers that offered very big amounts of olive oil that were necessary for the studies, or producers that gave higher amounts of money, not a lot, but higher than most of the other people. Just to give an example, that every producer that has let's say, an annual membership to the non-profit organization, he offers 100 euro, and that's all. But we also had some producers that were able to offer about 5,000 euro to support a specific study. But we're not talking about hundreds and thousands of euro, as it's commonly performed in governmental grants.
And it all started, the first one that you did was with the blood platelet reactivity.
Well, this is, I would say, this is an exception for concerning the amount of funding, because the first clinical trial, which was the most important among all of them because it's opened the way.
Right.
It was supported by a Greek company named EVOO Foods in collaboration with Captain Vasilis Foundation, and they both combined their forces and they offered an amount of about $50,000 that was used to support the first study in humans that was performed in University of California in Davis. And in that case, we studied an olive oil coming from Greece that was compared with an olive oil that was produced in California, and also with a commercial olive oil that had not any phenolic content. So we had 3 different groups and we compared all of them. And this was the first time that we were able to show that the high phenolic olive oil, and especially the olive oil with the high oleocanthal content, was able to show an observable effect just 2 hours after the consumption of olive oil.
Right.
Until then, it was unknown if any high phenolic or any type of olive oil could have a measurable effect on the blood of the people that participated in any study.
Right.
And this was the first one. It was the first study in the world that was able to prove an instant measurable effect from olive oil, and the fact that the olive oil with 0 phenolic content had no effect. It was the first proof in the world that the phenolic content is directly related with an instantly measured effect on the human body.
Because this olive oil, they actually drank it. They drank it, and then after 2 hours, they took a blood test, blood and analyzed it.
Exactly. Yeah. We're not talking about studies that were lasting weeks or months, and we had effects that were measured a long time later. We're talking about the instant effect. And this effect was related with the aggregation of platelets. And this is very important because when you consume a high phenolic olive oil and your platelets have reduced tend to aggregate, then it means that you have a protection against thrombosis, against coagulation of blood. So that means that you have a protection against heart attack or stroke. And this is something that we know from epidemiological studies, that the olive oil offers some protection for these 2 cases. But this was the first proof that you can measure this effect just 2 hours after the consumption of olive oil.
That's amazing. Yes, that was an amazing study. It really changed, for myself, it was absolute proof that there's something here that's bigger than anybody imagined so far. And the NMR gave us the opportunity to be able to choose the olive oils precisely for their phenolic content, to see which polyphenol or phenolic compound is the one that has the most effect.
Exactly, because until then, there were no precise methods how to measure the oleocanthal content of an olive oil. There were some approximate methods or methods using equivalents of other compounds, but NMR is the only method, was the only method until then, back in 2015, that was able to measure precisely the accurate concentration of oleocanthal in olive oil.
Mm-hmm.
In that period, in 2015, we also started another study concerning the effect of consumption of table olives on the cholesterol level.
Mm.
The first results were announced in 2016 in the first conference that was held in ancient Olympia in Greece with the Olympia Health and Nutrition Awards. And in that case, we studied the effect of consumption of 5 table olives every day in the cholesterol level of healthy humans.
Mm-hmm.
And we were able to observe a reduction on the bad cholesterol, the LDL, and an increase of the good cholesterol, the HDL. The most interesting is that after that, we proceeded to study the same effect on patients with high cholesterol,
Mm-hmm.
not healthy people.
Mm-hmm.
And we were able to see in a study that was performed in 3 hospitals in Greece that we had again the same effect. Even in patients with high cholesterol, who were in risk for development of cardiovascular diseases,
Mm-hmm.
that the daily consumption of specific olives with specific concentration of phenolic compounds, hydroxytyrosol and tyrosol,
Mm-hmm.
could have a very strong impact on the cholesterol levels.
Yes.
We were able to observe even a 50 units drop of the bad cholesterol in just 1 month.
Wow.
And again, this study was supported by only one table olives producer, the Sekelaropoulos Farms from Greece.
And it was just 5 olives, right? Just 5 olives.
Just 5 olives every day without changing anything else in the everyday diet. I have also to say that this study was submitted as a proposal to get funding from the state, the Greek state, but unfortunately, and it was very disappointing then, that it was evaluated as a proposal with no usefulness for the Greek economy. Fortunately, a company based in Germany and owned by a person of Greek origin learned about the rejection of this proposal, and this company said, okay, don't worry, I will fund it. And after that, we continued, and just a few weeks ago, we got a patent about this.
Fantastic.
And yeah. The Greek state was not interested about this, but of course the Greek entrepreneurs were more interested and could understand the potential of this of this application of table olives.
Yes.
This is just an example of how either the olive growers by themselves or other people outside the official authorities of the Greek state have assisted the funding of all those studies. Because the same thing was also repeated with the study that we started a little bit later concerning the Alzheimer disease. Because back in 2016, the announcement of the first results of the study that was performed in UC Davis in California, and also the first results with the cholesterol effect of table olives, motivated another Greek company, the Yannis Olive Grove company from northern Greece, who decided to offer a very big amount of high phenolic olive oil for a study in patients with mild cognitive impairment. Mild cognitive impairment is a condition which is considered as the early stages of Alzheimer's disease. So we chose 50 people at this condition, and we started giving them high phenolic olive oil for 2 years. You can understand that the cost of all this amount of olive oil is really very big.
Yes.
And we're grateful to those people who decided to offer their olive oil.
Yeah, that's about
and
4
of
tons.
Course,
yeah, it's about 4 tons,
yes,
about 4,000 liters.
And now, after the end of the study, we were able to show that the people that were consuming high phenolic olive oil, after the end of the intervention, had ameliorated skills and ameliorated results in the cognitive tests.
Right.
And this is the first time that we were able to, any study in the world that was able to show that olive oil can protect from the deterioration of the symptoms of Alzheimer's disease.
But specifically high phenolic olive oil.
Yes, the high phenolic olive oil.
Yes.
There was also one other group of people with the same mild cognitive impairment that were not consuming high phenolic olive oil. And in that case, there was no effect.
Although the diet was the same, was a very good Mediterranean diet.
Yes, both groups were following a strict diet. It was in the pattern of the Mediterranean diet, and they were all following the same pattern of diet. We also had a third group of people that were consuming a moderate phenolic olive oil, and in that case, we were also able to see a positive effect.
But not as much as the high phenolic.
Not as much in all tests, but it was the first time that we were able to show that the phenolic content of olive oil has an effect on the cognitive behavior of the people that participated in the study.
Yes, and it's also dose dependent. So the more you have, it was a better effect with a high phenolic olive oil rather than the medium.
Yes, it is dose dependent. Yes. And you know, this is something that some years ago, it had been studied in animals in the United States. And again, the study had showed that the animals could be protected when they were consuming either high phenolic olive oil or pure oleocanthal injected in their body.
Right.
And this is something that had been studied in animals, and we moved forward and we studied the same effect on humans. And we were able to prove that the same activity also is true for humans.
Right. That is amazing. That is amazing. That's like groundbreaking.
The results of this study were published. Yes. And this is the results of this study, which started back in 2016. It was published last October, just 1 month ago, almost 1 month ago. So it means that all those studies take a lot of time, a lot of effort, and they cost a lot of money. But again, you know, the same study, although we knew that the activity is there, it had been published since 2013 and 2015 in the United States in animals. So we proposed to the Greek state to fund the same study in humans. But again, we had the same reply that this is something not useful for the Greek economy, which is very strange. Let's use this polite word. But this is also very disappointing. But fortunately, the results were so important that makes us to forget all the problems related to the funding of the project.
Amazing. Yes, I know about this problem with the Greek state and the bureaucracy, and I've studied it for the last 8 years, and I've been trying to figure out what it is. And what I found out in the end is that it's a very deep cultural bias that runs through the bureaucracy, through the cultural ministries, through the research organizations set up to administer grants and so forth, that they do not want, they see olive oil as a food, not as a medicine. So there's a cultural bias to say, no, this is, in fact, they've told me this directly. They actually said this, and they said this in public. We do not want the olive oil to become a medicine because we want to keep the prices low so that people can have olive oil to drink. So, but this mentality is like from such a consciousness of lack, like we don't have enough. Like there will always be inexpensive olive oil. This is a very small part of a very small part of the production.
You know, when I started working with olive oil back in 2005 in the University of Athens, when I first proposed to my colleagues that, you know, probably there is something very active in the olive oil, some ingredient which is very active, they told me, come on, it's impossible. Olive oil will never become a drug. Olive oil is a simple food. What are you expecting to find in olive oil? But this was in contrast with what the ancient Greek doctors were saying about olive oil. Because 2,000 years ago, Dioscorides was very clear about this. He was saying that the olive oil coming from unripe olives is a very important effect on health, which was very distinct from the olive oil that was produced from the ripe olives. So meaning that there is something inside that makes unripe olive oil and ripe olive oil very different. And our study, published back in 2012, was the first that showed the big difference between those type of olive oils, which is mainly related with the oleocanthal content.
In the early 60s, we had early harvest olive oil as a medicine. That's what it was. When I had a headache, my grandfather would put the olive oil on my head. If I had a toothache, I would gargle with it, and it would help the pain to go away. That's how I grew up. But this knowledge was lost, and just I think since the 80s, something changed in the culture. Something, I'm not sure what the culture went through. I wasn't here at the time, so I can't say what happened in Greece. But it seems that now knowledge was lost, and now, and I'm so happy to see it being revived, because to me it's my childhood. You know, that's how I grew up. Olive oil was used as a medicine. It was not just a food, it was both. We had early harvest olive oil, and we had olive oil, normal olive oil.
Yes, then when we started observing all those unexpected results, because when you study olive oil, you can see so clear results. They look unexpected. Because if you think that olive oil is a simple food, and suddenly you observe measurable effects on blood, measurable effects on cholesterol, measurable effects on central nervous system, then it means that it's not a simple food. It means that it has something very important, contains something very different from other foods. So then we decided to go to something much more risky. And I will explain what I mean with the word risky. Back in 2007, there was a big scandal for the treatment of cancer, the word frappelia. It was the production of a juice coming from olive leaves.
Oh yeah, it
That
was a
was
smoothie,
used
olive leaf
to
smoothie.
treat.
Yes. Olive leaf
Exactly, yeah.
smoothie. Yes.
And back at that time, it was considered as a very big scandal that made all scientists to be very afraid of working with anything related with olive and cancer.
Yes.
But in 2015, there was a very important study in the United States that the most important ingredient of olive oil, oleocanthal, showed a remarkable effect on cancer cells. So the scientists from the United States showed that oleocanthal could kill cancer cells very rapidly, just in 30 minutes, without affecting the healthy, the normal cells.
Right.
I was contacted by a woman who was suffering from multiple myeloma, which is a type of blood cancer, where she could find a very high oleocanthal olive oil. So I proposed here the olive oil coming from Corfu, the olive oil, the governor.
Right.
Our studies at that time had showed that this specific variety affords an olive oil with very high oleocanthal content. So I proposed here to start drinking high oleocanthal olive oil every day. I remember this moment when she called me back 6 months later,
right,
and she told me crying that she had not need anymore to continue with chemotherapy.
Wow, I didn't know this. Wow.
Just by drinking high oleocanthal olive oil every day.
Right.
So this was an unofficial observation.
Yes.
From a woman in the United States,
right,
that followed our suggestion without any risk. The addition of olive oil in your diet every day has no risk. But it was difficult for somebody to expect such an effect in so short time, just in 6 months. So having this
you must have been
observation,
shocked.
I was shocked,
yeah.
yes. And I remember the moment when she called me crying, telling me that she had just received the results from the last blood test. And her white blood cells had dropped down and she was back to normal.
Wow.
So I tried to convince some colleagues here in Greece to follow the same protocol in patients suffering from leukemia. So we decided to start with the chronic lymphocytic leukemia, which is a condition where the blood cells are increasing every week, every month, gradually they increase. And well, when they reach a specific level, then the patient has to start chemotherapy.
Right.
But until then, there's nothing to do. You just have to wait. So we said that, okay, it's not a risk to try to give to those people a high oleocanthal olive oil to drink every day. And I'm very happy that a medical doctor, an oncologist from Greece, we started with a small group of 5 people. And after 3 months, we were able to see a significant improvement of the levels of their white blood cells. We had a significant drop.
Right. But after 3 months, you saw the result, not before?
Yes. And after that, we decided to expand the study to 25 people and monitor their blood white blood cells for 12 months.
Mm.
And what we found was that 12 months later, the white blood cells had dropped back to what they were 1 year earlier.
Oh, really?
So this is again an amazing result, because the people were doing nothing else but drinking 40 grams of high oleocanthal olive oil every day.
Did they have any dietary intervention? Were they given any
Nothing.
changes in diet, exercise?
Nothing yet.
Nothing. Just the olive oil. Just replace your olive oil with this one.
Nothing else.
Right.
We're continuing their normal life. Yes.
Whatever you were doing, whatever you were eating, meat,
And
or
again, this
whether you were
study,
vegetarian or not,
yes,
didn't matter.
yes, yes. And in all people, we were able to see a drop of the white blood cells in all people that participated, either small or big. This study was supported in two ways by the olive growers. The first one was the olive oil producer, the company, the governor from Corfu, who offered this high value. Yeah, they donated the olive oil. And the other way was the support from the World Olive Center through the small donations of hundreds of people that managed to gather 15,000 euro that were necessary to support all the blood tests for the patients that participated in the study. So with the combination of these two types of support, we were able to complete this study.
Amazing.
And this study now is ready to appear as a publication in the next months. The study has been completed.
Is it next month or months? 1 month or many months?
No, in the next few months. In the next few months. I expect the next probably 2 or 3 months.
Okay. Wow, looking forward to it. That would be amazing. Yeah. Yes. That would get somebody's attention.
Yeah.
That should get somebody's attention. Not here in Greece, in North America, in Europe, anywhere else, anybody hears this, they'll go, what?
You know, I have been, because, you know, we have announced the results of this study in conferences. The preliminary results have been already announced in conferences.
Yeah.
And I have been contacted by people from 2 other countries, not from Greece, that would like to start the same protocol in hospitals in other countries.
Yes.
So I'm sure that it will attract interest from many people around the world, because it's something that has very low cost, has no risk, and has a very clear benefit.
Yes.
And it is not just an observation. We know exactly that the ingredients found in the high phenolic olive oil, and specifically oleocanthal and oleacein, they can kill the cancer cells in vitro. We know that they can kill the cancer cells in vivo, in animals.
Right.
And we have a proof now that the same happens in humans.
Right.
So we have the complete chain of experiments.
Now, in leukemia, the white blood cells, are they considered cancer? I mean, it reduces the white blood cell count. They're being overproduced.
Yeah, the problem with the leukemia is that the proliferation of the white blood cells is not under control from the body. Right. We have a continuous increase of the number of white blood cells until they become they have so big number that has a very bad effect on the health of the body.
Right, right.
So the target is to reduce the number of the white blood cells back to a normal level.
So what is that? Do you not understand that? Have you discovered what the effect is that causes this? I mean, does it simply take the blood cell, the white blood cells to produce at a normal level, so it resets the body, or does it actually do something else? Is it a reset?
Well, the most interesting observation is that the effect of oleocanthal on the number of the white blood cells is not similar to what would be expected for an anti-cancer drug.
Right.
It takes about 1 month or 1.5 months until you start observe the drop of the white blood cells.
Right.
Meaning that it is something like a reprogram. We had also a control group that was consuming an olive oil that was high phenolic, but without oleocanthal.
Oh.
And in that case, we were not able to observe such an effect.
So there was no effect.
And another interesting point is that one volunteer that participated in the study, she started consuming the high oleocanthal olive oil, and after a few months, the white blood cells had dropped down, more than 50% dropped down.
Right.
But it was during summer, and the amount was not enough. And so for 2 months, she had stopped consuming the good olive oil.
Ah, okay.
The white blood cells started again going up when she stopped consuming the high oleocanthal olive oil. And when we observed this, we said, okay, we give you again the good olive oil and you should start drinking it again.
Every day.
And 1 month later, the white blood cells had dropped down back. So meaning that this is, we call it self-control. It's the same people is control of himself.
Yes, yes. So you can see the direct result.
Of course, we have the number of people that have participated in this study is small. It's relatively small. It's just 25 people. But the next step is to expand this study to 100 people or more. But for this type of studies, you definitely need big funding.
Yeah. Well, I think you're going to get it as soon as the study is released. I think when the study is published in a medical journal,
Yeah,
I think things will change. This will be this will be the moment of change.
Yeah, we hope so.
Yeah.
We also hope the same thing for other studies, which is related with multiple sclerosis.
Yes, oleacein.
Now, the multiple sclerosis is a system that it is attacking the nerves in the brain. And back in 2016, we decided to start a study to investigate the effect of the phenolic ingredients of olive oil in the degeneration of the nerves in animals.
Right.
There is a model. It's called. It's an animal model which is called autoimmune encephalomyelitis. The animals that are exposed to an agent that causes this disease, after 30 days, they are paralyzed. They cannot move. So what we did, and we did it in collaboration with a group of Spanish researchers in the University of Valladolid, we provided them pure oleacein to the animals, and after 30 days, the animals were moving as if they were normal,
Wow.
while the animals that did not take oleacein were paralyzed.
That's amazing.
A patent related with this observation. It's a common patent between the University of Athens and the University of Valladolid. What we did from our part was to develop a method how to isolate oleacein from olive oil.
Right.
And we're grateful to the company, it's a Greek company, the company Elavon, that offered a big amount of olive oil with high oleacein content that we used in the laboratory to isolate pure oleacein and provided it to the Spanish group that studied the activity of oleacein in the animals.
Right. That study was just published, right?
It has been published just 1 week ago.
Yes.
But remember that it started in 2016. Again, it took 4 years to come to these results, to get public. And it's also interesting that this work was funded by the Spanish Ministry of Research, while in Greece, it was not funded by anybody, just from the olive growers.
Because it's not valuable to the olive oil
industry. It's something not valuable.
No, not at all.
Yeah.
We have to laugh because that's all you can do.
Just also to say that in parallel, we have started a study in humans with multiple sclerosis. This study started last year, and it is performed in 2 places, in Cyprus and in Thessaloniki, in Greece. And again, the study is supported by one company that offers the olive oil that is used in this study. And it is also supported again by the World Olive Center for Health, who supports a student who is doing this study as a PhD. We offer to this student a scholarship to support the research.
Amazing. I love the way different forms of collaboration happen as well between different countries, and it's really warms my heart to see a Spanish university using a Greek olive oil to do the research on mice, or an American university using Greek olive oil to do the research on cancer or blood platelet aggregation or.
Yeah, you know, at this moment that we're talking, there are 2 clinical trials in the United States that are using a high phenolic olive oil from Greece.
Yes.
One is a study that it is performed in the University of Auburn in Alabama with, again, with Alzheimer patients. They're using specifically selected high phenolic olive oil from Greece because they cannot find such high quality olive oil as this that can be found in Greece. And the second study is performed in UC Davis.
Sorry, which olive oil is it that they use?
It's the governor from Corfu. And the second study is in UC Davis, California, where we study the effect of high oleocanthal olive oil on a big number of patients concerning the platelet aggregation. It's an expansion of the first study that was performed in 2015. Now this time, this study has been funded from the American states. The olive oil that is used is the Achas olive oil from Cyprus. From Greek varieties of olive oil.
That was from the variety
Greek varieties of olive trees.
From Kalamon.
From Kalamon variety.
And they had the highest ever found. It was almost 4,000 plus, almost 5,000 milligrams per kilogram 1 year.
This is true. This is true. It's the highest phenolic content ever recorded among thousands of olive oil samples comes from this specific variety from Cyprus.
Yeah, that was fascinating. I know when I first saw that, I immediately got on a plane and went down to see the farm, because they were using permaculture methods and regenerative methods in the olive grove. And they were also right on the green line between the northern, which is occupied by Turkish, and the Greek Cypriot to the south.
Yes.
So it was all very interesting combination of events.
Okay.
The olive oil, the conflict between Turkey and Cyprus, and this amazing olive oil that came out of it.
Yeah. One of them is supported by California Berkeley Olive Grove, who support phenolic olive oil on athletes.
Yes.
Collaboration with another Greek olive grower who is offering also an amount of olive oil for this study. We have two companies that support this study, which is performed in collaboration with a sports academy of the University of Athens.
Right.
And the other study is supported from another olive grower, which is called the Liva olive oil.
Right.
And the owner of this company has offered his olive oil, but also he has offered a scholarship through the World Olive Center for Health to support a student who is studying the effect of high oleocanthal olive oil on the platelet aggregation of diabetic patients.
Oh, that's it. What type of diabetes?
Type 2.
Right.
The highest risk related with diabetes is the platelet aggregation that makes them very sensible to the formation of clogs, blood clogs.
Right.
So they have high risk to suffer from a heart attack or a stroke. That we have a very good result. And these results were recently announced in a Greek conference. And we expect that the study will be completed until next June, and then we will be able to present the complete results during the...
That's the Olympia Health Awards that the World Olive Center is doing.
Yes.
For health.
Yes.
Right.
Yes.
Fantastic.
So this is all the description of all the studies that have been performed during the last 8 years.
Anyway, thank you. Thank you for taking the time to talk about all this. I know it's sometimes it's difficult, but it's also, it's really a triumph, as I see it, not only for science, but also for the Greek olive growers, Greek culture. And eventually it will go up into the Greek government as well, so they can understand that olive oil can be a medicine and the food at the same time. And there's no conflict between them. There's no conflict. And nobody will lose. We'll only gain. There's no loss here. That's a major thing. All right. Well, on that note, Dr. Magiatis, thank you for your time. I know you're very busy these days. Despite the lockdown, you have a lot of work to do. So thank you for taking the time, and we'll talk soon.